to expect during your hospital birth post-COVID-19 pandemic. Number one, visitation policy. So every hospital is going to be different nationwide regarding their visitation policy post-COVID-19 pandemic, but I am increasing your awareness on this topic so that you're able to ask those questions so you're better prepared for your stay. With more research and evidence-based practice, policies are ever changing, and the visitation policy is no short of that. A lot of hospitals have improved their leniency, and they're allowing 2 personal guests, family member, partner, 2 total for the labor and delivery stay. So again, check with your facility to see exactly what you can expect regarding visitation. As it relates to the postpartum stay, so this is going to be after you've given birth and you are transferred to the postpartum department, unless it's a LDRP where you don't transfer rooms. But if you are transferring to another department, some hospitals change their policy to go back to the 1 visitor for the duration of the postpartum stay. Okay, and that visitor has to remain the same visitor throughout the stay, and that visitor is allowed to stay overnight. Okay, so that's going to be really imperative because that extra visitor that was allowed in labor and delivery may have to leave, and then that 1 person should have everything prepared and packed and, make sure the stay is well prepared, because that 1 person will not be able to come and go out of the postpartum unit. Some hospitals are allowing that visitor to come and go freely during the postpartum stay. So again, you want to make sure you know your visitation policy for the particular hospital that you'll be giving birth. Number 2, nourishment and meals. This is going to be a big one because you're going to want to ensure that your meals or nourishment is provided, or if it's not provided, you're going to want to pack accordingly. Okay, so that's for the preparation, increase awareness, improve the quality of your stay and your birth experience. So in this case, you want to ensure that for your partner and see if meals or snacks are provided. Now, usually, because of the COVID restriction before, we were providing the partner with a meal or a turkey sandwich, and some hospitals do not provide the spouse with any meals, any turkey sandwich, or any nourishment at all. Okay, so you're going to want to prepare with packing accordingly, high protein, small bites for your partner and for yourself. You also want to consider that you have other, methods to have food delivered, all of those apps where you can have food delivered to you, that's acceptable. And now with the new policies for most hospitals, you are able to come and go from the labor and delivery department, unlike in the heart of the pandemic, the 1 visitor was kind of stuck in the room. In this case, you're able to come and go in the labor and delivery department nowadays for most hospitals. So number 3, mask requirement. Okay, so again, this is going to be a topic of concern probably for another year or another season to come, but mask requirement is a thing throughout the US for most hospital settings. Now, I've not traveled to one hospital setting that didn't require employees and the visitors to wear masks. So in the labor and delivery department, it's no different, no short of that. Now, your visitor and yourself will have to wear a mask, especially when you're walking in the halls or walking to your room. If your visitor is going to get ice or water or any snacks that are provided, the mask will be required. Now, some hospitals allow you, to the partner and yourself, to remove your mask if the employees are not present in your room, and it's behind a closed door, a single occupancy. So as long as you're in your room by yourself, there's no healthcare providers, most hospitals allow you to lose your mask until a provider or the healthcare team comes in to treat you for anything. So keep that in mind. The expectation is wearing your mask throughout your stay unless you are the healthcare providers or the team is not present. Because the labor and delivery stay can be, in the postpartum stay, can be about 1 to 2 days, sometimes even 3 days if it's an induction. So you want to consider packing several different masks that are easy to breathe, that you enjoy, so that you are able to switch out your mask daily for hygiene purposes, etc. So a lot of moms are concerned if they would have to wear their mask during the stay. And the answer to that is going to be, there's a gray area for that, because Most hospitals, it won't be in writing, but most hospitals allow the mom to lose her mask, especially if she's pushing and they're during the second stage of labor. Okay, most nurses. So, but again, it's usually healthcare personnel specific or provider specific. You may get one nurse that says, I don't mind, her COVID test was negative, or I don't mind, it's during second stage and I wouldn't expect a mom to push with a mask on during the, pushing effort. So again, it may vary. Number 4, COVID-19 testing. On admission, the expectation is all patients that are admitted in labor and delivery, you would require a nasal COVID test by the healthcare personnel. So your nurse would perform that test and do a COVID test on admission. Okay, so that's usually the request and the expectation these days. Now, recently, we haven't been requiring the support person to be tested for COVID or have a negative test. That's why the expectation is that that person wears a mask throughout the stay when the healthcare personnel are there, and that most often the mom can lose her, or expecting mom can lose her mask during the second stage because she should have a COVID test result on file. And some hospitals are doing away with COVID testing altogether. So again, every hospital is going to vary. This is just going to be to increase your awareness so that you're more prepared. And the more you know and the more you expect, the less anxiety you have for your stay. And remember, we'll talk about this more in other videos, but anxiety affects your whole birth experience, your birth process. And so the more you know, the more you can expect, the more we can decrease the fear. Speaking of COVID testing, if your COVID test comes back positive, okay, or if you have symptoms, you name it, they'll treat you as positive until your COVID test comes back negative. So if you have symptoms and we're waiting on a COVID test, you're going to be treated as positive, okay? And then if you have a positive, you'll be treated as a positive, of course. Healthcare provider or personnel that come into the room will wear PPE, okay? Additional PPE than for most standard precautions. So it will be contact precautions and droplet precautions, okay? So the team will wear an N95 mask. They may also wear another mask over it. So don't be alarmed if you notice a lot of gear, okay, because that's going to be normal and expected for protection of the team, okay, and other patients and the other team members, etc. So they'll also wear a gown, okay, disposable gown. They'll wear gloves, okay, and a lot of providers wear the hat or the bouffant cap or the protect their hair. Okay, so just extra gear, maybe even shoe covering. So you'll be in an isolation room and the PPE will be increased. So don't be alarmed if all the team members are taking extra precautions during your birth and experience. Number 5, operative room. So in the event that your birth experience leads to a C-section or a cesarean section, most hospitals during the COVID-19 pandemic were not allowing any visitors in the room at all, in the operating room at all, okay? Some hospitals are now allowing one person in the operating room with additional PPE on because it's a sterile procedure. Now, some hospitals are still restricting that one visitor in the operating room despite the COVID-19 test results, okay? So please consider that. Find out where your facility's policy is on the operating room and what support you'll have so that you mentally prepare yourself. Again, number 6, infant rooming in. Okay, so most hospitals are baby friendly and rooming in is the way to go. Okay, so the expectation is that the baby stays at the bedside with all of the interventions and every newborn testing, you name it, baby will be at the bedside. Now, during the heart of the COVID-19 pandemic, if mom came back with a positive COVID test, the baby would be isolated in a different department, maybe the NICU or the newborn nursery, where it's an isolation for babies to be separate from mom if mom came back with a positive test. And they were doing testing on the newborns, but today is a little different. I believe there's still, and again, every hospital is different, so this is just increasing awareness so you can check with your hospital policy. But if you have a positive COVID test, most babies are staying at the bedside with mom and isolated with mom together. and breastfeeding is still allowed. Because I know initially there was a lot of research and development on the topic regarding isolation or if breastfeeding is okay, breastfeeding is not okay. Again, it's just constantly evolving. So find out what the policies are for your specific facility that you'll be giving birth. So you have, again, more awareness and a more enjoyable birth experience. And that does it for this video. Thank you for watching my tips on what to expect during the birth experience in a hospital setting post-COVID-19 pandemic. Thank you for watching. Put a comment below if you've had your baby and some of this stuff was helpful, or if you find anything else to be helpful, or any other tips you want to share with our community. Thank you for watching. I look forward to seeing you in the next video. Merci.